What if your body was storing poison for years and you didn't even know it? Wilson's disease is rare, deadly, and often missed. It can destroy your liver, hijack your brain, and cause psychiatric symptoms that look like depression or schizophrenia. And the scariest part? It starts when you're a kid. Today we break down everything you need to know before it's too late. Wilson's disease may not be a household name, but its impact is significant. It's a reminder that sometimes the greatest dangers are the ones we can't see. This essay aims to shed light on this hidden enemy, empowering you with knowledge about its causes, symptoms, and treatment. Wilson's disease is a rare genetic disorder that prevents the body from properly eliminating copper. Copper is an essential mineral, crucial for healthy bones, nerves, and brain function. However, in Wilson's disease, copper builds up to toxic levels, primarily affecting the liver, brain, and eyes. Imagine a bathtub with the faucet running, but the drain plugged. The water level rises, eventually overflowing and causing damage. Similarly, the excess copper in Wilson's disease spills out from the liver, damaging other organs and disrupting their normal function. The root cause of Wilson's disease lies in our genes. Genes are like blueprints that dictate how our bodies function, and a single flaw in this blueprint can lead to disease. In this case, a mutation in the ATP7B gene disrupts the body's ability to transport copper. This mutated gene is passed down from parents to their children. If both parents carry the defective gene, there's a 20% chance their child will inherit 2 copies of the mutation and develop Wilson's disease. Wilson's disease is a master of disguise. Its symptoms can be incredibly varied, often mimicking other common ailments. This makes early diagnosis a challenge. Some individuals may experience fatigue, abdominal pain, or yellowing of the skin and eyes, indicating liver damage. Others might exhibit neurological symptoms such as tremors, difficulty speaking, or personality changes as copper accumulates in the brain. The eyes may also be affected, with a characteristic brown ring around the iris known as Kaiser-Fleischer rings. Unraveling the mystery diagnosing Wilson's disease. Diagnosing Wilson's disease is like putting together a complex puzzle. Doctors use a combination of methods to confirm the diagnosis. Blood tests can reveal low levels of a protein that carries copper, while urine tests might show elevated copper excretion. A liver biopsy, where a small sample of liver tissue is examined, can provide definitive evidence of copper accumulation. Eye exams can detect Kaiser-Fleischer rings, a telltale sign of the disease. Genetic testing confirms the presence of the mutated ATP7B gene. One study that analyzed cause of death in 300 patients with WD between 1948 and 2000 reported that the principal cause of death was diagnostic failure, followed by a lack of adherence to treatment recommendations and the development of malignancies after 10 years of follow-up. Before 1948, all patients died shortly after a WD diagnosis, typically after neurological symptoms appeared late in the natural course of the disease. Fighting back treatment options. While there's no cure for Wilson's disease, early diagnosis and treatment can significantly improve quality of life and prevent serious complications. Treatment focuses on removing excess copper from the body and preventing further accumulation. Medications like D-penicillamine and trientine bind to copper, facilitating its removal through urine. Zinc supplements block copper absorption in the gut. Lifestyle changes, such as following a low-copper diet, are also crucial. The importance of early detection. Early detection is paramount in managing Wilson's disease. If left untreated, the buildup of copper can lead to severe liver damage, cirrhosis, and even liver failure. Untreated Wilson's disease is always fatal. In the brain, copper toxicity can cause irreversible neurological damage, leading to tremors, difficulty speaking, and psychiatric problems. Early diagnosis and treatment can halt the progression of the disease, preventing or delaying these complications. Early treatment may allow patients to live a normal lifespan. Regular checkups and screenings are vital for individuals with a family history of Wilson's disease. It is crucial to diagnose the disease before serious symptoms develop. Living with Wilson's disease. Living with a chronic condition like Wilson's disease requires ongoing management and lifestyle adjustments. However, with proper treatment and adherence to medical advice, individuals can lead full and productive lives. Support groups and online communities provide a platform for individuals and families to connect, share experiences, and find emotional support. Remember, you are not alone in this journey. A beacon of hope. Wilson's disease may be a lifelong condition, but it doesn't have to define your future. With early detection, consistent treatment, and a positive outlook, individuals can manage their condition and live fulfilling lives. Advances in research offer promising avenues for new treatments and potential cures. Remember, knowledge is power. By understanding Wilson's disease, we can empower ourselves and others to take control of our health and embrace a brighter future. Subscribe to our channel for more intriguing content on health and wellness.